Hi, I'd like to go into a little bit of detail about the non-surgical operation we do to help people with chronic knee pain. This non-surgical operation is resetting the communication between your brain and your knee. And when you lose this communication, what happens is you actually lose the tone in the muscles. So muscles do two things. They're either going to lengthen or strengthen, just like if you make a muscle with your bicep. You're going to strengthen or lengthen it. What happens is those fibers are crossing over the actin and myosin fibers, and they're either going to get larger in a strengthening position, or they're going to get longer and thinner in a lengthening position. So there's two primary nerves that we're concerned about with the knee. In order for your right knee to work properly, power comes from the left side of your brain. It travels down the spinal cord, and it runs across the nerve all the way into a tiny little muscle called the popliteus muscle. This muscle basically unlocks the knee. So your knee is a hinge, but it doesn't just do this. It unlocks so the tibia and the femur clear, and then it comes back together. So there's an unlocking mechanism that is accomplished by this muscle right here. So you need to have clear communication going all the way down. The other nerve that we're concerned about is the femoral nerve. Again, from the left side of the brain, it's going to control the right knee. It runs down the spinal cord, and it's going over this nerve root here. And this nerve is going to run right into the quadricep. It ends about the lower part of your lower leg here. And you have all the muscles that are going to control, or the nerve is going to go into the muscles of the quadricep, which extends your leg. So every time you would take a step, you kick a soccer ball, you're firing that femoral nerve into the quadriceps. So we're talking about the sciatic nerve. Okay, let's do that in red. So we'll line it up. Here's the sciatic nerve on this side, same thing. And then we're talking about the femoral nerve. And the femoral nerve is the one that goes into quadriceps. So extension and unlocking of the knee is accomplished by the nerves that are running through these nerve roots right here. What happens is there's a disconnect. It can happen from a problem in the low back. There's many different reasons why it can happen, but there's a disconnect and the knee stops unlocking and extending properly. So what we do, my team performs a non-surgical operation that resets the communication between the knee and the brain instantly, decreasing pain and inflammation, increasing flexibility, increasing strength, and assisting in tissue healing. And then we put you on different therapies, and then I do any tune-ups along the way that we need to after we've accomplished the goal of getting you walking better. So that's basically it. If you have more questions, please call our office. Our staff is ready to schedule you for an appointment. We'd love to meet you and love to be able to help you. God bless.